There we are, live.
Morning.
Good afternoon here in Montreal.
Hey, it's still morning here.
I know, and you were just telling me about the great weather you're having, and I'm very happy for you, but it makes me frustrated with, the snow shoveling going on here, and you're walking around in shorts and short sleeves.
Right, yeah, exactly.
Lucky for you. Well, thank you for so much for coming on. I'm Stephanie Erickson. I'm the author of Plan for Aging Well, and I'm a clinical social worker. And today we're going to talk about healthcare disparities. And I'm very excited. I came across Dr. Bryan Gaines, I think on LinkedIn, or maybe you were commented in an article. I can't remember how I came across you, but did a little stalking, looked into your experience in a professional way, a professional stalking, and really appreciate all the great work that you're doing in this area. Let me just tell you a bit more about who Dr. Bryan Gaines is. He serves as co-chair and project specialist for Advocates for African American Elders. He's also assistant director of the Hartford Academic Center of Excellence in Geriatric Social Work at USC, University of Southern California, which is back in my hometown. And most recently, you served as a director of professional training at the Alzheimer's Association in one of the California chapters. And your experiences and your specialties, program development, program evaluation, elder health and geriatrics, and specifically related to Alzheimer's disease and other dementias. And you also cared for your dad for 7 years when he had dementia. So there's that personal connection as well. Thank you so much, Dr. Gaines, for being on. I appreciate it.
Thank you for having me.
So we're going to talk about a lot of different things. Let me tape my notes to my computer. This is how I do it, because I'm going to remove my glasses so there's no glare. So then I have to put the font at like 30 in order to see because it's so far away. There's so much to talk about with you. Like, your experience is very broad. We're going to focus on the African American community, which is a community that you're currently working with and you've done a lot of work with and program development and such. I know that this first question that I'm going to ask you has a lot of different ways you can go, and I know that your response is not even going to begin to talk about the problems within the African American community. But what do you see in terms of elder care, seniors, healthcare disparities? What are the biggest concerns for the African American community?
Yeah, that's a loaded question.
I know.
But mostly with the work that I am focused on right now has a whole lot to do with poor health outcomes. And we see that in the African American community with our seniors on a regular basis, whether it's managing their diabetes or whether it's heart condition, whether it's, cholesterol, diabetes, all of those health conditions, that are just having such poor health outcomes. That's most of the focus. So I would say, with what I'm seeing on the ground and the work that I'm doing, I would say that health disparities and more importantly, not just the disparities, but health literacy, because a lot of times, it's not just the disparities in and of themselves. It's understanding and having information and the knowledge to know how to actually manage some of these chronic health conditions, because the ideal is that some of these things are manageable. And it doesn't always require medication, but because of the lack of health literacy, many people, that's why we're having poor health outcomes. And so I would say that that's the greatest, thing that we could focus on, is increasing people's health literacy that would ultimately, hopefully decrease, some of the health disparities that we're seeing that are having such poor health outcomes.
So let me ask you about this health literacy piece, because I don't think you're talking about necessarily formalized education starting in elementary school or anything like that. You're talking about something that's much bigger, much more systemic, probably, and access to information as well as formal education. That's my guess. But what do you mean when you say, literacy, health literacy? What specifically is missing? What are other groups being offered and given? And what are African Americans not being offered or given? Or, what are the differences there?
Right. So, most of the times they have, like, let's take diabetes, for example. You have standard pamphlets and informations that are designed. They're designed by the associations in these groups, and the ideal is that they give these to the hospitals and the clinics and things like this, and they pass them out to their patients and whatnot. And a lot of times these materials, the patients they don't understand the material. Some of them can't read, and so there's all of these things that go into how that's being designed. And so I would say, that in my focus is to really, how do we develop, materials and things and get people information they really need to help them better understand, what they're dealing with so that they can actually manage it. And so with diabetes, we did something in the community that was really basic. We kept saying, well, they're getting all this good information. Why aren't their numbers better? Why aren't they managing their diabetes better? Well, what we found out is that many of them were having problems with their eyesight. And so it wasn't that they weren't managing, they were having trouble drawing up the appropriate insulin. And so, and then, in terms of like, well, what about diet and lifestyle change? Well, you have all of this verbiage with all this information about what to do. And it was something as simple as like, well, let's just put pictures up there to show them what they shouldn't have versus what they can have, rather than, a laundry list of things that you shouldn't have. And so basic, simple things like that, so that people can understand it in a way that, that is useful to them, and not, at such a high level that they can't understand it.
So it's interesting what you're talking about. I have to move this. It's bugging me. I'm going to just pull this down, and you might see me looking at my notes and looking down, whatever. It's interesting what you're saying to me, because you're talking about the delivery of information needs to be more culturally sensitive and appropriate, and recognizing that different groups, different communities learn differently the way that they hear and access information. And I'm not talking about, cognitive skills and abilities. I'm just talking about how how information is shared within a community, that information needs to be culturally appropriate. It needs to be sensitive and tailored specifically to whatever community it is, African American or another community. But the other thing you talked about, just in mentioning even the eyesight, because that then goes beyond, because now we're talking about access to, appropriate eye health and care, and access to optometrists, and having your vision looked after, and being provided glasses, whether you might have difficulties based on finances or location. I don't know what the difficulties could be. So it's like two different levels that you mentioned in just that response.
Yeah, absolutely. And that last piece that you mentioned there, the interesting thing about that is that we were taking a closer look at that, and we thought, we have all of these diabetes programs that are going on all across, Los Angeles County, and, all of these pamphlets and posters and things like that. But yet we're still seeing high levels of amputation. So when you think about that, you think about the two, it's like, well, you've got all this information out, all these trainings and all these classes that are going on, but the level of amputations are still high. Well, the only reason why we would think we're getting amputations, was because that they're not managing, their diabetes appropriately. But then when you dig a little deeper, that's when you find out, no, it's not the case that they're not managing it properly. It was the eyeglasses, it was the eyesight, and was not having access to eye care to pay for eyeglasses and things like that, which didn't allow them to draw up the insulin appropriate, so it looked as if they weren't managing their diabetes. And so what did the community-based organizations do? They basically take them off the program. We're going to remove you from the program so that we can assess what's going on, and then, maybe we'll put you back on. But between the time they remove them from the program and that time, that's when the amputations happen. So we clearly knew that we needed to look on multiple levels. It's not just focus on one area of what might be happening, in terms of marketing and the literacy level, but also looking at other things that people may not have access to that might be causing them not to appropriately manage their chronic health condition.
So what happens there? I mean, we can hypothesize in a lot of ways, but a lot of these, let's just take diabetes. I like going down this route because it's something that you're saying really impacts the African American community. And one thing that what I'm hearing you say is, it's not that people don't care. It's not that people aren't trying to manage effectively. It could be that there's a barrier like eyesight, or just the information is not presented to them in a way in which that they can absorb it, whatever that looks like. But what happens, because it's the marketing departments, let's say within the companies that even make the drugs, that create these marketing materials that end up at the clinic. So is it a problem that goes all the way back to that higher level in the development of the how the information will be disseminated down to the clinic, or is it something that's happening more on the ground in the clinics that people aren't recognizing that there's this gap with people need good eyesight in order to properly measure their insulin?
I think it's a little bit of both. I mean, I think they can do better on both ends. I mean, when you're working and you're trying to disseminate these medications in the community, a lot of times it's, the pharmaceutical reps, they work directly with the doctors and the clinics and things like that to get the information out. But at the same time, there's not an effort to work directly with the community to identify the appropriate words to use, the appropriate pictures to use, and all of these different things that are just not happening. But also at the same time, in the community, I think at the agencies and the clinics, I don't think that they're recognizing the impact that their delivery systems are having on particularly seniors. It's this idea that you have a program and you roll it out the way that it was given to you. You make no adjustments, you take nothing into consideration. And at the end of the day, if it doesn't work, you say that it failed, or, if they don't show up, you pretty much say, well, we brought it to the community for them, and they didn't show up. Well, it's like, but you offered it on a Sunday. And a lot of the older African Americans are in church on Sunday. That's why they didn't show up. But they don't take that into consideration. They basically they just check the boxes to make sure we get it done, rather than taking a real critical look at what we need to do. I mean, it's really requires having a think tank of people that are from the community to allow you to be able to come up with the best ideas and the best strategic plans for all of these different things that then need to be shared with pharmaceutical companies and things like this across the board. But I think we need to do a better job at bringing folks from the community together to talk about some of these things so that we have better messaging and communication around those things.
And that's something you and I spoke about before when we had our first conversation before going live today, is that the way, because if you go back to the development of a medication, let's say, or a program, first they're going to say, okay, here's identified problem, and now we're going to create this solution. But there's a gap. This is what I'm hearing you say, is there's a gap in having the people who are on the ground in the community who really understands what's happening in the development of whatever even that goal is, or that product is at the end of the day. But when we were talking offline before today about research development and program development, you were saying that part of the problem starts with the research question. It's just not even the right question. So people at some level make a decision, we need to serve the community like this. They develop a research question, but then they can't get the right data because the question wasn't even right, but they're sort of locked into that question because that's what then the funding is based on, is answering that particular research question. Am I saying that right? What we had talked about, like the development of the question and such?
Yeah, absolutely. Which is why the exact work that I do with Advocates for African American Elders is so important, is because we involve the community at every level from the inception of the idea. It's like, and so internally you may come up with a research question, which is fine, but then you take that research question to the community. That you talk to the people that are there, and so that you can identify immediately, because one thing about the community, they will let you know exactly when you're going down the wrong pathway and you're asking the wrong question. They will clearly identify what that is. And I think that's the beauty of the work that in involving the community, is that you get these real, true information from people in terms of how they feel, and they represent the population that you're actually trying to target. And so I think I think that's a really, really important piece that's really left out, because what happens usually is internally they develop this idea, they put it out there, and they kind of move forward with it, and they just expect the community to grab on to this whole concept, and that's not what happens. And so I think they really, they miss an opportunity to design the appropriate questions, by doing things like, basic questionnaires, focus groups where you bring people together, just throw the question out there. What do you think about that question? And
So
then you get all that information starts to just flow in. Yeah.
So how are these relationships built, Dr. Gaines? Because if we need to serve the African American community and really any community, because this could apply, right, probably to many different communities, to serve a community the best way and to make sure that the programs we develop and the products and the medication, all that serves a particular community, we need to involve that community in the development of even the initial questions that then drive the research and the funding that follows, and then eventually the program or the service or the medication, whatever it might be. How do you start building that relationship? Because if the researchers aren't thinking of that and the community knows it to be true, our communities relying on individuals like you to kind of shout from the rooftops and take that proactive step in reaching out to the developers and the researchers to ensure that things are done in the right way and that people in the community are engaged.
Well, I think from a leadership's perspective, I think the first thing that many of the people in leadership that are developing, designing, and overseeing a lot of this work, first thing you need to do is you need to commit to hiring someone that is going to cultivate and build the relationships in the community, because this is not something that you just you go into the community and all of a sudden everybody welcomes you with open arms. I mean, even if you look just like them, it doesn't mean, because for example, when I first started working in the community, with USC, the first thing people in the African American community thought is they said, "Oh, those people from USC sent you out here." That was their initial, but it was about building a relationship with them. And so hiring someone to cultivate those relationships. And the reason why those relationships are so important on so many different levels. But the first reason why it's important is because you build a relationship with the leaders in the community, whether it's the pastor, whether it's the director of the adult daycare center, or the social worker that works in one of the community agencies, but has a large group of people that they work with. Well, you're building these relationships and you cultivate these relationships over time, whether you belong on committees or boards or whatever that may. Well, over time, these people get to know you. And so, like I said, it's not something that you can just flip the switch and start doing. You have to cultivate and build these relationships over time. And then when you're working with individual groups, particularly within the African American community, it's building those relationships with the directors and the leaders in those communities are so important, because that's who the people listen to. And so, for example, if you're at a church and the pastor says everybody show up on Saturday for a brain health class, everybody will be there. And so, same thing with the senior center. You can go in, you want to conduct research. You just can't show up at a senior center and think you're going to conduct research. They're looking to that program director that oversees that senior center, because that person, is the person that they have trust with. And if that person trusts you, then you have access to the group. And so that's why the relationships are so important. And then in addition to that, when you're looking at developing programs and services and want to get funding or do research and things like, having those relationships with the community partners, that's where you get your letters of support, so people can support your work that you're doing. Because without those letters of support, you have very limited funding, especially for programs that are unique and they really haven't heard of them. And so they really need to know that you have a group of people that trust you and trust your work and are working with you.
So, I mean, it really takes a lot of time. Cultivation is a word that you used, and I mean, obviously, this takes a lot of time, and it must put a lot of pressure as well on the whole situation, because funding is only available usually for a certain amount of time. There's a window, and so there must be some urgency. Um, and in terms of the people that are within communities, and they're the key people, right? So there might be someone a bit on the outside who wants to bring something in, establishes a relationship with some key players within that community, key personnel, and then information can be disseminated like that. How common is that turnover of those key personnels? I mean, would that be a barrier?
It could be at sometimes, and it's funny that you asked that. Is that because that barrier usually happens a lot with like community-based organizations and places like that that have high turnover, and so you have this great relationship with someone, and then within 7, 8 months they're gone, or in a year, and you just have to continue the cycle. You start over again, and if there's a good transition within the agency, a lot of times that new person will reach out to you, or the person that's leaving will make that link and that connection because you've built that type of relationship. And so if there are things that, people that are really, connected and want to make a difference, is just because they leave that job doesn't mean that they don't want to pass the baton to someone else to continue that. And that's something that we talk about in the community is being more responsible professionals, where you leave you leave a legacy of your work. And so that when the person comes in behind you, they're not starting from scratch. They have a contact, they have a connect. And so we do, I do a lot of work with that. But in terms of, people in the community, outside of working with older adults, because there is this thing, the older adults, some of them do pass away. And so they have key positions. And so when I say, leaders in the community, the leader of like a block club, which people don't think about, a block club. Well, block clubs, they have a neighborhood block club. They have a huge drawing and a huge connection. And so having that lead person is important because they trust that person. Well, sometimes we don't see a lot of turnover in groups like that. So like church groups, the director of the senior services in like a mega church, you don't see a lot of high turnover unless they pass away. So the most part, most of those relationships are pretty solid, over the years, which is reason why we can even look at doing longitudinal studies, because those relationships last for so long and they're connected. But in terms of the agencies, that's an issue that we deal with a lot. But as I said, the more we talk about it as on a professional level, and we're learning how to have a better transition, I think that's been helpful. And if other groups, begin to say, let's be, responsible professionals to make sure that the next person coming in to do your job on day one, they can come in and they can basically figure out what are the important things and who are you linked with and what meetings you go to and how you're connected in the community, and go out and introduce themselves.
Yeah, so they can hit the ground running.
Exactly.
I want to talk about brain health, but Ian had a comment, and I just want to bring it in. He said he agreed. This was a while back, so I'm not sure which point that was. And he said, checkbox leadership is easy. We do need a think tank, especially for home care and seniors, but who leads government? LOL. That's what he said. Yeah, but you're right. I think we do know there's think tanks, and it's so funny, lots of the words you're talking about, leadership and transitions and all these things, and then the state of the US right now, like this is the transition and all of this is in flux, and you can see what happens when there's disorganization, right? Anyways, I don't want to go down that route. So let's talk about, in the last bit of time that we have, brain health, because I know that's something near and dear to your heart personally, in supporting your father who had dementia, your volunteer work with the Alzheimer's Society. Is it Alzheimer's Association or Society?
Alzheimer's Association and Alzheimer's Los Angeles.
Okay.
Two local agencies.
Okay, so I know that this is a subject near and dear to your heart, myself as well. As a dementia specialist, this is something that means a lot to me too. So let's talk about the current kind of like state of affairs of how brain health is conceptualized, I guess, in the African American community. Is this a topic of conversation equal to that of management of diabetes or some other of those health issues you brought up? Or is this something that's very taboo? Like, what's the state of affairs there?
Absolutely not a topic of conversation. It's actually very, rare for, people to talk about, brain health. It's not, because it's not something that's presented, even in their routine medical checkups. And so which is very different from diabetes or, blood pressure and things like that. And so no, it's not a conversation that people are having, but the conversation that people are having because of the impact is Alzheimer's disease. And so, you hear conversation about that, but, it's still at a level to where, I'm in a crisis. I need help. It's not just because we're sitting around the table and we're talking about how this disease is impacting, our community at such a high rate. Is there anything that we can be doing about it? We're not having those kind of conversations. The conversations that we usually have when it comes around Alzheimer's is around a crisis. So that's pretty much kind of where we are, in the community. We've been doing brain health and outreach and education for a very long time, but there hasn't been a real big push or a movement that has allowed it to become, something like diabetes, to where it's being talked about at that level.
Yeah, and I mean, I can't, I'm not directly involved in the African American community, or any community specifically. I kind of run the gamut. I serve all populations in what
Mhm.
I do, and I see that theme very common. I don't see that it's unique to the African American community. No one wants to talk about brain health and Alzheimer's disease. I mean, here I am a specialist in it, and I don't want to think about it for myself either. I mean, that is just like, it's such a hard sell, that conversation, which is unfortunate because there are things that we can do in terms of lifestyle changes to help the prevention of, and certainly early intervention is essential. So what is sort of your game plan in this area, since it is your, direct focus of work? What's your game plan to try and reach out and improve the way information is given to the African American community, and even second to that, actually absorbed and heard and accepted?
Mhm. Yeah, and so for me, I've been on a mission to really educate the community about the impact of Alzheimer's disease, which has kind of led me to change the narrative, really, around the conversation that we're having. And because again, like I said, a lot of people don't know about brain health, and so, but when I changed the narrative from having a town hall meeting about Alzheimer's disease versus having a town hall meeting about brain health, the ideal is different. It's easier to get people to want to listen to brain health. It's easier to get people to say, what's the difference between this and how is that working? And so that's kind of been my game plan, is really changing the narrative and really focusing on some of the benefits that are associated with brain health, and the connection between chronic health conditions and how all of those things are linked to brain health, and particularly with seniors, because brain health, like I said, we've been doing that for a while, and I wasn't really sold on the whole idea, because we've been telling people for a long time, you need to change your lifestyle, healthy eating and healthy snacks and exercise, all that's good, but we've been talking that game for a very long time. And so I started thinking to myself, in terms of plan, it's like, well, what's going to get people to wake up? And I'm like, is it like the PSAs we used to have years ago, where you had the egg in the pan frying? This is your brain on drugs.
Oh,
I mean,
yeah.
it's like, do we need to do something like that? Do we need to have a fear campaign? Do we need to have like a bullet going into someone's head? It's like this disease is horrible. And so I started thinking, I said, well, particularly with the seniors, if I can start identifying benefits that are associated with brain health, and I mean real benefits that mean a lot to people. For one example is like, wanting to be able to keep your independence. So if you start showing signs of cognitive decline and your driver license gets taken from you, you can no longer drive. Well, if we focus on changing your lifestyle and we can give you information about brain health, and we can help ward off potentially some of those things that could lead to cognitive decline, you may be able to drive for 5 years more.
And that's really a strategy for a lot of things, right? Is you have to bring the story in as to how it impacts someone directly. Because if you talk about brain health, it's a very macro approach. What does it mean? How does it even affect my life? But if you can relate that personal story of, how you love to take your Sunday drives and blah, 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 whatever it is that relates to a person, how would you like that to be taken away? Sometimes that can get people to, you know, have a different type of a conversation. Tell me that story again. I know that I've heard it, but I want all the viewers to appreciate the story of how your first approach in having a discussion around brain health kind of
Ah,
tanked and what you had to do in order to really connect with the community. Because I think this can hopefully inspire different people to maybe try a different approach in the way that they um, create these environments for people to have learning like in larger groups.
right. Yeah. So it's really about being innovative, with all of this work that we're doing. It's like, thinking not just outside the box, but thinking outside the warehouse and come up with very creative
Mhm.
things that you can do. But one great example I had, years ago when, I was very, very fresh and excited and was just out the gate and, work. And of course, everybody said, you got to work with the churches. You got to work with the churches. And so, of course, what was I doing? Working with the churches. And so I had one really big mega church that I was working with that had, a large number of of members. And so we decided that we were going to do, an Alzheimer's, and dementia presentation for the church, for the whole entire church. And so we were going to use the big space and have all that. And so we worked months and, we put out flyers and we put it on all of the social media and all of those things. And with a great little lineup of what we were going to talk about. And we were really proud. We were proud that we came together and we were expecting us, we were going to have food and, all of these things. And so, but our very first event, we only had a couple people show up from a mega church. And basically, our flyer talked about Alzheimer's disease, and we just figured people were going to show up. And so after the event, of course, we had our debriefing, and we started, thinking. We were like, well, we wonder why people didn't show up, and so me with my thinking outside of the warehouse, I'm thinking, well, people are not really excited about showing up to talk about Alzheimer's disease. If you guys stop and think about it, who wants to come and sit to something that's depressing that wants to talk about that? And then I came up with this idea of there's a killer among us. And basically what I did is we took the same flyer, the same idea, the same church, the same people, and we changed the name of the flyer and we put there's a killer among us. And we didn't mention anything about all things. And I tell you, the RSVP and the people that showed up, the house was packed. We had people, and I can remember telling the crowd that was there last month, this was the same program that we were talking about last month. And you came here to see who the killer among us was. And I tell you, it's the same person that it was last month. It's Alzheimer's. That's who it is. And so that's an example of, of changing the narrative and really connecting with the community because everybody was interested, like, who's the killer among us, And so it really resonated with the African American community. And and we've used that, several times for different things. And that's kind of what I was saying when, about the egg and the whole brain and all that type of stuff. Sometimes you have to think about, well, maybe we need to do something that's a little more hardcore. Maybe we've been too soft about it in the African American community. It's like, oh, well, you need to change your health, like, your lifestyle and all these things. And maybe we need to come out with something that really, really, gets people, to hit hard, and not to mention that, since we're in Los Angeles, a part of my plan and my hope is that, brain health can really become something that's a talk, among athletes. We have football teams here because it impacts people, with sports, with concussions, that lead to Alzheimer's disease and things like that later in life. And so if we can get, things like, really motivated around brain health and get people really connected, and create champions where people are having these conversations where when you go on a website to look at Kaiser or look at LA Care Health Plan or something, you'll see that there's a brain health program. You'll see that there's something that's associated with that because right now you can do a search of all the medical places that are in your local area, and you probably won't find anything at the centers that are focused on brain health or Alzheimer's. You'll see something for weight loss. You'll see something for diabetes, smoke cessation. So all of those things you'll see those, but when it comes to brain health, you don't see those things.
Exactly. So there's a few things that I just want to say. First of all, what a catchy title. I mean, there's a killer among us. That's just a downright catchy title, right? And there's a shock value to it.
Yeah.
So I love that you use that. I love the expression thinking out of the warehouse instead of thinking out of the box. I don't know if you came up with that, but I love it. I will always give you credit. I'm going to start using that. I love that idea. Third, side note, let's get professional athletes involved. Excellent idea. Go Rams. As you know, we're in the playoffs. I'm an Cali girl. Go Rams. Huge Rams fan. So let's get them on Saturday. That's a very side note. And I just also wanted to mention that I think one of the challenges for those in the academic world, when we have really good intentions of what we want to bring to communities, as I did as a young social worker, I'm not a young social worker anymore, but man, did I make so many mistakes because I had all this training in school, do this, do that, boundaries, ethics. And so you're almost frightened to do anything that might be outside the norm. And I remember when I first started as a social worker in the community in LA, and because I speak Spanish, I was very much in the Latin community, the Hispanic communities, visiting people. And as you know, in LA, African Americans, Hispanics, they live in close quarters in many of the different areas. And so I went into a lot of these homes and I was told, you have to keep your boundaries and be very professional. I was not accepted in the beginning. I mean, I was that, outside social worker coming in, professing whatever I was professing. It was an awful experience for me. And I'm sure for my clients. And I'm embarrassed to think back at some of the things I said and did as a young social worker. And then pretty soon I learned, oh, I'm supposed to be having coffee. I'm supposed to be trying whatever it is that they've made, on the stove that day. When I go to make a visit, I can't expect to be in and out in 15 minutes. When I go, and if they ask me to stay and have coffee or try this dish, I need to be there for an hour and a half and kind of throw all of these ideas that I had learned in school to the wind. So I think that's one of the struggles, at least for those who are excited and starting in the field, is how do I match what I know versus what actually is real in the community?
Yeah, I think you're absolutely right, and that's been one of I think that's one of the things that allows me to be so successful in working in the community is because I'm just authentic. It's like you go to school, you get these degrees and things like that. It's like I don't care about being called Dr. Gaines and those kinds of things. And when I go and talk to the community, I'm not going to use a bunch of fancy words that they don't understand. I'm just down to earth and I really connect. And, when they say meet people where they are, I think that's that's something that we really need to be able to do and not be afraid, because if there's something that you don't know, just ask.
Totally. And say it, I don't know, because when you are authentic and vulnerable that way with people and say, I don't have all the answers. And certainly the more that I develop in my career, I say that all the time now to people who I'm coaching and counseling and helping is, I don't know. And it really helps people to open up and then share their story. We kind of got sidetracked, but I just wanted to mention is I know what it's like to be fresh and excited and make a lot of mistakes. I did that a lot. I'm sure I'm still making tons of mistakes. So Bryan, as we didn't say Dr. Gaines, now I'm just calling you Bryan because you just said
That's
don't call me.
exactly.
What would you like to say to end this? Like, what do you hope is going to happen in terms of the closing of the health disparity, and especially in terms of brain health? You want to just share some last things and hopes that you have?
Yeah, sure. I think for me, I do a lot of different work, but one of the things that's always at the forefront of my work is public policy. And so I'm always, I'm looking at the things that are being developed. I'm particularly focused on the Center for Disease Control with the Healthy Brain Initiative and the roadmap that's been developed, because I was a part of that from its inception. And so, but I'm not completely happy with the way that it's been implemented or rolled out, because it's kind of like what we're dealing with now is here's the roadmap. Every state take it and you figure out what you're going to do in your community, to make it work. Here's some great examples and some things for you, but we're not going to, help you any further than this. And so really focusing on policies and things that, really impact our community, and really looking at how we can, how I can actually help, like the National Institutes of Health that actually has a tremendous focus around looking at research from a scientific viewpoint, but really, to really push people to really stop and think about some of the non-traditional research that needs to take place, such as community-based participatory research, where you're doing focus groups and you're doing surveys and questionnaires and things like that on the front end. You're inviting people to sit at the table, in planning and development for a lot of these programs and services that you're developing. So I'm hoping, that's my hope, is to really let advocacy and policy drive all the other things that I do, knowing that, without the proper policies and the proper advocacy, our work just is all for naught, because unless we have things that, I call it working upstream and downstream. It's like, I'm downstream and I'm working here, I'm boots on the ground, but at the same time, I also have to be focused with the social work background on what's happening upstream. How are policies being developed? Where's the funding streams going? Are they funding more for cancer versus Alzheimer's disease? All of those kinds of things are all important to me. And so, so for me, I'm going to continue to advocate for programs, boots on the ground, what I call low hanging fruit. You just grab what you can. And that keeps us going, and recognizing that, research dollars, to do sometimes there's a trade-off. You may have to do a little scientific stuff in order to get your community stuff done. So you go in with people for some of these larger grants and things like this that have a scientific focus, but at the same time, you can go do like a whole host of community things and develop all kinds of materials and fans and cups and things like that to do in the community. So really, just really focusing on how I can really, reach across, the university, work with different departments. Everything doesn't have to be within social work. There's other room in other departments, medical centers and things like that. So looking, forward to having more collaborative partnerships to where we can all make an impact on a much greater level than we have in the past.
Well, you're inspiring me to think that maybe I'm too narrow in my work. I work so much directly with clients, and I try and do things like this to have a broader approach and inspire and educate people in a broader way. But now I'm feeling like you're right. I should get more involved in policy, because I have a lot of ideas of how things could work. But as we know, with so many different problems that our world has, systemically, if we don't make those changes, and in this context, I'm talking about policy and all the funding that backs up that policy, if we don't change that system, then as you said, it's all for naught. So I'm going to rethink this and think of how I can help. Let me know how I can help you. And thank you so much, Dr. Gaines, for being on. I really appreciate it. Let's for sure stay in touch, and go Rams.
All right. Yes, go Rams. Well, thank you for having me. I really enjoyed this, and I hope we can definitely, work together at some point in the near future.
Me too.
All
well,
right.
Thank you.
All right.
Okay.
All right. Bye-bye.